Thank you very much. I wasn't quite sure what to make of this particular title. And maybe you'd like to help me. What is keeping well? And then we can consider it with liver disease. I was looking to the audience to have a clear idea what do you aspire to in your own lives in terms of living well, and what do you aspire to in terms of your children? I'm now a grandparent, and I know that there's at least some other grandparents in the audience. Respect. And I know that when you get to be a grandparent, you've done it once, or maybe more than once, and then you could take a step back and tell somebody else how to do it. So if I come at this a bit like a grandparent, you'll please excuse me, I can't help myself. So I think there is a sense in which keeping well with liver disease is the holy grail. It's what we all would like to do. We'd like to think that despite this unfortunate affliction, whatever it might be, we can make life as close to normal, as good as it can possibly be. And that's not easy, it's a challenge, but nevertheless, I can maybe add a few reflections which could help. And if you don't agree with them, or if you know something better, and you may well do, please interrupt me. Okay, now let's see what I can do with this. Not much. Okay, so what does well mean? What does keeping well mean? Well, I think I've touched on that. I think it's something aspirational that we all have for ourselves and our children. And I don't think that having a child with liver disease makes any difference to that, but it adds some extra burden, some extra responsibility, some extra context. And in amongst this is, I don't know if you remember Donald Rumsfeld when he was contemplating invading Iraq, that he said that there were some unknown unknowns, which really means there are things we don't know that we don't know. And these things are prone to come and bite us. And we have to be aware of them. They come in from out of field, and all of a sudden they're there, and we've got to think about what to do quickly and get information. I also think it's really important to remember that we are the best parents our children can have. And here's one from a grandparent. Slowly, we all turn into our parents, for better or for worse. Sorry to have to tell you that. So, parenting doesn't come with instructions. Nobody ever told me what it would be like. What I do know is it's difficult, but not that difficult, but it is relentless. It goes on and on. And there are some styles of parenting which have associated outcomes. It's hard as a parent to be insightful of what sort of a parent one is, and in fact, when one becomes a grandparent, one goes and reflects back about what kind of a parent one was, and then one beats oneself up about it. But nevertheless, we realize that we accept certain behaviors, and we're with high acceptance or low acceptance, and we try to control or less so. And of course, when children are ill, the possibility or the feelings about acceptance and about authority and control are influenced. And I think that having a child who is chronically unwell may influence the style of parenting, with perhaps consequences for the outcome. And, of course, when we look to the future, and I think the thing about parenting is it always leads to the future, hopefully, and as I said, I picked this up off the internet, I thought it was lovely. Adolescence is not for everybody, parents or adolescents. And we see here, I'm not sure if you're familiar with this, I don't know if the psychologist touched on it this morning, but when you encounter something in your life, whether it's losing a job or finding out your child unfortunately has a problem, then you inevitably, because you're a human being, go through these stages. Did the psychologist touch on these this morning? No? Does this work? Yes. The idea that initially you're in shock, you just can't believe it, you're stunned. And then denial, it's not happening to me, or they can't be right. And then frustration, why don't things happen? Why can't I have an answer? Why can't we investigate? And then depression, what can I do? Hopeless. But then trying new things and making decisions about what needs to happen and integrating the extra requirements of the situation, a child with liver disease, for example, into daily life and trying to make it work as best we can towards a normal life. This again, this same model, this same curve applies also to transition to some extent. When young people encounter the situation where they realize, because they're old enough to understand now, that they have got a problem which they're going to have to take through to adulthood. They also go through these curves. And in particular, depression and experimentation are often seen in young people's understanding of behavior as they go through this towards adulthood. And it's to be expected, and it's not easy. So I thought I would also reflect for a moment on what is a diagnosis. Diagnosis is a name, of course, but people just assume that the doctor has an answer for every medical problem. But I think it's important to reflect maybe, and I'm sure you've been through this, that particularly if the diagnosis is a if the diagnosis is a complicated one, that often a lot of tests were done and started with a history and an examination and some tests, and the test took a while to come back. And I liken that a little bit to a jigsaw puzzle, that the diagnosis doesn't consist of one thing, it consists of a whole constellation of evidence, and sometimes there's one piece of the jigsaw puzzle which is the answer. And early on, because it's an easy piece to get, the doctor has that piece, and the jigsaw puzzle may not have all 25 pieces, it might only have 2 or 3 pieces, but it's obvious what the answer is, and that's an easy early diagnosis. But sometimes there may be 17 or 18 pieces of the jigsaw puzzle there, but they're not enough to make the picture. And then one more might turn up, you put the last piece on, or not even the last piece, but the second to last piece, rearrange the other pieces, and oh, it's not the diagnosis we thought at all. So the concept of a diagnosis is not a finality, it's a way of thinking, it's a model which the medical staff have to go through, and hopefully you're on board with it, in order to come to a conclusion about what the answer is, and obviously what needs to be done. Because a diagnosis leads to a treatment and a prognosis, an outcome. And I think that, I'll put this slide in, I don't know how well this projects, but this is not anything to do with medicine, this is to do with spread betting. I don't know if any of you are familiar with spread betting, but basically what it says, spread betting is about trying to tell the future. It's trying to say what's the value of or the cost of something or other in so many years' time. And there's a sense in which the prognosis for any condition is a bit like spread betting. It's about what's the future going to be in terms of the best possible or possibly the worst possible. And what are the indicators we have along the way which tell us what the future is going to be. So there's a sense in which the prognosis is the doctors trying to see the future, not in a mystical way, but in a statistical way, in as far as they're able. Okay, if that makes sense. Okay. So what is the medical model? This was what I was taught at medical school, which wasn't recently. And so the idea is that the patient turned up with a problem and told the story, the history, to the doctor, who arranged some examination and some tests and made a diagnosis. But why is it becoming obsolete? Well, you may have an opinion on this, but I think in amongst here is things like the internet, discussions with family, style of parenting. You always ask your parents, I'm sure, if you're worried about your children. Certainly my children ask me. And as a result of that, all sorts of additional influences. And along the way, people say, well, you know, the doctor's telling me so-and-so, but I can't make sense of that. But what I can make sense of is information I've had off the internet. So this is what I think. And that can end up with potential conflicts or misunderstandings or lack of commitment to what's going on in the hospital, for example. And so I think we as professionals, and I think parents who are also involved in it, have to accept that there's a new sort of dialogue which is necessary in understanding what's going on, particularly with the investigation, the diagnosis and the treatment of all sorts of patients. Okay. I'd also like to maybe examine this, that life consists of uncertainties and risks. Nothing is certain, and if you cross the road, you might get run over. You know, nothing is completely safe. But we have to consider, if we unpick risk into the likelihood of something happening, the probability, and the consequence, so that we cross the road because, although there's a chance of being killed by a bus, the risk of it happening is extremely low. So we're over here, you know. So the consequence would be terrible, but the likelihood of it happening is very small. Whereas there are some other things, and in our context, there is the possibility of being a live-related liver donor. And the chances, we haven't had a death in our pediatric liver donor program at King's, but statistically in the world, the chances of a donor dying giving a piece of liver is probably 1 in 500. Now, I don't know how you feel about that, and I don't know whether any of you will encounter that situation, but there's nothing in my life that I do that has 1 chance in 500 of me dying. So I would regard this as, you know, very high risk and relatively high risk and high probability. But nevertheless, for your children, you might well do it, and I might well do it. So I thought that I would touch on also the idea of prophylaxis versus treatment, and the idea that prevention is better than cure. There are some treatments where we're treating a condition where, particularly in liver disease, there is no external manifestation really of the condition. The patient, particularly the young person, feels well. They may actually feel worse taking the medicine than they feel without it, because there may be side effects, for example. Nevertheless, we have good evidence, and medicine has to hinge on evidence, that to take the medicine means that in the future things will be better, the liver will be better, and therefore we are preventing future complications, and therefore we're changing the natural history of the condition. The natural history is, if you like, the thing, I've put a whale from the Natural History Museum just to think about that, but the natural history is about what is likely to happen in the future. In other words, what is the prognosis according to my spread betting model. And ultimately, treatment needs to either improve symptoms or hopefully improve outcomes, change the prognosis compared with what it would have been. So this doesn't come out very well, has it? So there is a sense in which, when we're talking about medicines, we in the past we used to talk about compliance, and this goes back to my idea of the medical model that the doctor knows best. Well, we don't accept that anymore. Society just doesn't accept that the doctor knows best. The doctor's helpful and may know more, or may not, than some people, but does not necessarily know best. So therefore people people don't necessarily do what the doctor says, and rightly so. They need to ask questions, they need to fit the suggestions into their own life. There's the idea of convergence, that the doctor and the patient and the family understand each other about what their priorities are, what their acceptance of risk is, what their acceptance of side effects is, and what they're willing or not willing to do to achieve a certain outcome. And within that, there's the idea of engagement, having committed to do something, that people do it. And whether that's organizing investigations in hospital or taking medicines at home, it is about all being on board with the same plan. And that requires a level of organization in the hospital and at home. So this model of engagement, which I fetched off the internet as well, is illustrated, I think, by what happens in a society like this, that there are those people who are observing what's going on, those people who are following and subscribe to updates, for example, those people who endorse or like posts or make comments or contribute resources, write comments in team spaces, for example, own what's going on, or lead and practice team space, for example. Now this is comparable, I think, with what happens in families where there is a child who has a condition, and where an increasing level of owning what's going on and leading and making things happen, I believe, leads to better outcomes, leads to a better future. So to be in charge of it, to understand it, to take a leadership in it, actually does make a big difference. To tell a story, and I think stories are helpful, I remember very well, a 13-year-old girl who had autoimmune hepatitis and who did very well. And she took her own medicine, and I thought that was exceptional at 13 years of age to organize your own medicine. So I asked her, how did she do that? She said, well, I've got a tidy bedroom, and I like to live a tidy life. And I think that really means that she was organized, and she was in control, and she had a clear idea of how she was going to do things, and it worked. And I think there's a sense in which good organization leads to good outcomes on everyone's part. So, and this leads to the idea of adherence, the idea of taking medicines. Now, I don't know that you can read this, but what this says is that for every 100 prescriptions, and this is not specific to children with liver disease, but so if 100 doctors write 100 prescriptions, that only 50 to 70% of them go to the chemist to get presented. And of those, about 2/3 are actually collected, and then 50%, or rather, 25 to 30% are taken properly, and 15 to 20% are actually, a second prescription is collected. Now, I think with motivation around parents and liver diseases, it's probably more than this, but the point remains that people do not necessarily take their medicine as prescribed or reliably. And I think that's part of life. That's not a criticism, it's an acceptance of the way the world is. So adherence is the extent to which a person's behavior in taking medication corresponds with agreed recommendations from a healthcare provider. And as I say, this statistic said that's about a bit less than a third of the time, but probably it's better. So there are some dimensions of adherence of taking medicines about patient-related factors, about social circumstances, the healthcare system and how it provides medicines or whether people pay for them, condition-related, and that possibly applies less in these circumstances, but certainly in dementia, patients don't take their medicine, and therapy-related, which is a lot to do with, for example, side effects. So we can do some things about that, and I think it's important that the clinical staff are insightful of the personal factors, the family factors that impact on having access to medicines, organising and giving them, and perhaps accepting side effects or not, being willing to take on costs. Of course, prescription costs are don't matter for children, but there are still costs in collecting them and costs of administering them, perhaps. And then interaction with the system and whether or not, for example, the GP is willing to take on prescription in a reliable way, and whether the pharmacy provides the medicine before the last lot has expired, as sometimes doesn't happen. So what can we do? I think we have an onus to consider drug regimes. We know that once, certainly adult patients are on more than 4 medicines, more than 4 means you take less medicines or medicines less reliably. So I think we have a responsibility to think about every medicine we prescribe as to whether it makes life more difficult and makes the likelihood of other medicines being given less. We have to reduce the cost barriers, which may apply more in the US than in the UK, but nevertheless there are cost barriers. Address patient behavior, help people organize their lives in such a way that medicines are not forgotten and they are collected, etc. And that young people learn to be responsible for their own medicines as well, and make sure that medication is monitored and is used appropriately by giving advice and help. So in conclusion, I believe that living well does involve a healthy and organized lifestyle. It's important really to understand the condition, understand the medication, and understand the interaction with the two and the risk of side effects, and have a sense of the likelihood of complications and the risk of them occurring, and reflect on the risks and what is acceptable. We can't live a risk-free life. Nobody can. So the question really is, what risks are acceptable? I mean, for example, people often say, I'm off on holiday, the blood falls when a blood test is due after transplant or something like that. Can we just miss that one? Yes, of course. Or we could do it a bit earlier, we could do it a bit later, or forget about it. There might be a risk associated with that. If the situation is stable, the risk is very small, and who would want to miss a holiday? It's really important for a family. So that's the kind of risk which is, reflect on it, decide it's the right risk to take, fair enough. And be clear, and in the event of complications, have a clear idea of what they are likely to be. You can't know the future, you can't know everything, but you can have an idea of those things that might happen and have a plan in the event that they did occur. I think one example of this is those patients whose families, we know that they have varices, and we know that they might be at risk of bleeding, and therefore we can go through a prospective plan about what to do in the event, how to recognize the possibility of bleeding, and what to do to make sure that the risks are minimized, and the anxiety associated with the risks is minimized too. And finally, I think engage. In other words, I think it's important to take on board the significance of the condition, the meaning, the implication, and to decide how best to organize life to minimize the risk and maximize the outcome. Thank you very much indeed.